guys, this is Sabrina here. Welcome back to my channel. So for today's video, I actually wanted to talk about my son's treatment. I did post 2 videos about his diagnosis and how we found out and the treatment plan, all of that, and my state of mind on my channel. So those 2 videos are still up, so if you want to check it out, see the background, to get more insight. Otherwise, I will try to be as brief as possible. But my son was diagnosed with leukemia. It's the acute lymphoblastic leukemia. So this is a form of cancer, of blood cancer. There's many blood cancers. This is a type that affects mostly young children under the age of 9 or 12. So we're talking about like newborns, 2-year-olds, 5-year-olds. So that's the age group that affects them. This is the age group where it's mostly prominent. And my son has been in treatment since he was 2 years old. He was diagnosed at 2.5 or so, July 1st, 2023. And in October, his treatment ended officially. He's still on antibiotics on a weekly basis for protection for a couple more months because he has still chemo in his system for at least 6 months. And now they just removed his port. So I have very much mixed feelings about the event. They removed it fairly recently, so I've been thinking about it for days after because it was very traumatic for me. I must say that the date that he was diagnosed and was reported to me was a shock to me, and I was numb and I barely cried because I couldn't believe it. I thought I was dead. I thought I was not really responding. I almost fainted. But when they actually added and inserted the port, like 2 days after this diagnosis, he was crying like a baby. I was distraught and mixed with shock, but I wasn't numb. All my feelings just exploded. Then I shut down again. Throughout his entire treatment, I literally shut down. Barely crying, just focused, counting the days for the end of the treatment, praying that he entered remission quickly and that it remained in remission throughout the 3 years. So, praying that he survived the treatment, because that's also part of the issue, the management of the symptoms and management of the side effects of the treatment. So, after all of this time, in which no tears were shed, honestly, because I was so focused in just keeping me alive, and towards the, until the end of the treatment, then they removed the sport, and again, I just exploded, and I cried like a baby again. And it's like all the tears that I have not shed throughout this process, it's kind of like came together on that day. And I had a similar reaction to when they installed the port. So everything reminded me of that event, of that day. The operation room, the doctors, the team were the same. My son, of course, was a little older. His reaction also was a bit different, but we'll talk about it in a little bit. And my reaction was exactly the same. And everything reminded me of that terrible day. Because you have to understand, the port, it has a lot of stigma, it makes it real. It's something tangible that, it's there, that he has. And you can see it, the wound, the scar. It's kind of, it's no longer an illusion, it's reality. And so for me, it was extremely traumatic. And once it became a reality for me, I just broke down to tears. Of course, the difference is that when the port was inputted, we didn't know the future, obviously, for my child. And then for now, we have removed the port, and this is good news. This is a good thing. He ended the treatment successfully. He survived. He's a cancer survivor. He's still in remission. He has been in remission since the for initial 30 days of induction, which is the initial 30 day of treatment, which is intensive chemotherapy treatment. So, so again, it's good news, but at the same time, it's still traumatic because it's kind of all my sadness, all my trauma was resurfaced, came to the surface again. Let me explain a little bit, my state of mind on first round when they did add it, when they did implant it, and also my son's reaction. I think that has something to do with my reaction. So when they put the port in, my son was so young, was 2 years old, he was not aware what was going on. So he was actually very calm in the beginning. Then, of course, being surrounded by doctor, being on an operation table, he started freaking out. You can tell that he was breathing heavily, that he was scared. But I was there, and he wasn't crying yet, but he was like breathing heavily. He was extremely scared of all these people surrounding him. He was 2 years old, and he was barely at the doctor's office. He was never really sick that much until he got sick of this cancer. So he got sick from this cancer, obviously, because he had flu symptoms when he started having symptoms of the cancer. So, he wasn't used to be surrounded by these strangers. He wasn't used to hospitals. So he was very much overwhelmed, but still he couldn't understand what was going on. And as you guys know, if you don't know, when they're inserting the port or removing the port, they have to sedate the child because they have to stand still, like in most operations. So they have to sedate them completely. It's a full, complete anesthesia. And so my son never experienced such a thing. We never had to sedate him. So it was really tough on his body because in the sense that his body reacted immediately. So obviously he was not used to it. So as soon as you see the medicine being inserted into this IV, you start seeing collapsing. So at one point he was flustered and he was complaining and everything, and then because he was scared and he didn't know how he was feeling, but immediately as soon as he was pushing the medicine in, his eyes went like this, like almost like when you're passing out. So basically that's the experience my son had when they implanted the port. And seeing him passing out like that was extremely, extremely traumatic, and it was a suffering that I've never experienced. And that's when they pulled me out once he fell asleep to operate on him. And yes, that was, oh my God, that's such a trauma. And to think that basically every month, every 3 months, at some point he was supposed to be sedated in order to insert chemotherapy or inject chemotherapy into his spine to prevent the cancer to attack the spinal liquid or going into the spinal liquid into his brain. That's also very traumatic. He has done many of these spinal injections throughout these 3 years, and they always had to sedate him. But for some reason, that first time was the toughest because it was a shock for him. He did not understand what was going on to his body, and he collapsed immediately because his body was not used to it. So he wasn't fighting. And so that was shocking, and that was traumatic. It was horrific. And now coming to the removal of the port and sedation experience, it was more horrific than I thought. My son over time has been getting used to the sedation. He woke up pretty quickly after the operation, after the injections into his spine. So like not even 5 minutes, like 1 or 2 minutes. They had to act very quickly because he just would fight it for so long, and he would just wake up very early, and they would use a very small amount. But when you have to do an actual operation like that, he has to stay asleep for at least 30 minutes. So they have to, put in more medicine, obviously, for this operation, like they did the first time. And I was holding his legs. He remembered the doctor that, of course, operates. And also, he remembered the doctor that puts in the medicine, because he's always the same one that puts the anesthesia in. And he's the one designated for it. And as soon as he starts screaming. He starts screaming as soon as he saw him, because he knew what was gonna happen. He doesn't like that feeling of falling asleep or having to fall asleep. It's like against his will, so he hates it. And as soon as he sees the medicine, he did something that he has never done, which is this, like he jumped, because he felt the medicine already in his blood, and he already felt it inside his body. He felt the effect of him starting to slip away, in a sense, and he started screaming and crying, and he was bursting tears, and he was locked into my eyes. His eyes were locked into mine, like trying to tell me, like, why are you doing this to me? I really don't want to fall asleep. So it was very intense, and I was crying, he was crying, and he was still fighting. It took a little bit to fall asleep, and then at some point, then he started going, like his eyes started blinking, and then at some point he collapsed to them, and then like slowly they pulled him down to the operation table, and then I was walked out, accompanied out to the waiting room, crying like a baby again. It's very difficult for me to compare the two experiences, because they're both equally traumatic, but seeing his reaction, I don't know, because his reaction was very traumatizing. I don't want my child to go through this. I didn't want my child to go through this. The first time and the last time, doesn't matter if it's the last time, and I hope it's the last time, but it was horrific to see my son fighting the medicine. But of course, you feel a sense of relief after it comes out, because you think of yourself, it's over. They removed the port. No more yucky medicine. So that's the beauty of this, of the last. I guess in the end, even though it was the last traumatic experience, which I don't wish on anybody, I felt a sense of relief, because it is over. I really hope it is over, because you never know in the future. It's always in the back of your mind once your child is diagnosed with such a very, very annoying cancer, because this cancer is actually very annoying. It comes back as such a high relapse rate. People always talk about the cure rate, but there's a very high relapse rate in leukemia in general, because it's kind of a bitch. It comes back very easily for some reason, because we're talking about the blood. These cancer cells hide in your body, and they're circulating everywhere, and there's hundreds, thousands of them. At the time of the admission, when he was diagnosed, they found 180,000 cancer cells in his body and bone marrow. 99% of his cells were all cancer. They were not normal. It was extremely high risk because of the volume of the cancer found in him. I guess because of the time out that it was passing. Maybe another time I can discuss a little more in depth, but I just wanted to focus on my experience of the removal of the port, and yeah, I just wanted to share it, because I'm sure that other families, other moms and fathers can relate. Of course, families with cancer patients, and also specifically children, because obviously this anesthesia, I don't think they do a total anesthesia for adults. I really don't know. I'm not sure, but probably not. But for children, they have to. So, because they move. Anyway, hopefully you guys, okay. I'm so sorry. This is kind of a different type of video. I just wanted to kind of share this information. It makes me feel better. It really does. So I just wanted to talk to somebody about this. I just wanted to share this because I think it might, like I said, it might help other parents going through this, hearing this, that there's an end to this tunnel. It was a horrific nightmare. That even in moments of joy, there is unfortunately some trauma, or some relieving the trauma, and it is unavoidable. So any blood test that he will be going to every month now for checkups is going to be a reliving of the trauma, just everything that connects to that experience, and he will be, like reliving the trauma, unfortunately. But it's just the curse of cancer. Thank you so much for watching, and I'll see you guys next time. Bye.